Hi, how are you?
Good evening, Dr. Nicholas. Please, can you hear me?
Yeah, I can hear you. How are you?
Very well, thank you, sir.
You can
It's
hear me
really,
well, huh?
yeah, I can hear you clearly.
Okay.
We're really glad to have you here this evening. Thank you for
Thank you
joining.
also for inviting me.
Oh, it's a pleasure. It's a pleasure. Hi,
Okay.
Dr. Linda. I'm seeing Zeleki as well, and I'm sure our president is also here, just behind the talk handle. Hi, President.
No, thank you so much. I'm trying to connect.
Um,
I'm happy to be here. Thank you,
good.
Dr. Nicholas. Thank you for honoring the invitation. Thank you so, so much. Yeah, looking forward to the session anyway. I'm looking
Yeah,
forward. I know Dr. Nicholas is loaded, so I can't wait to learn from him. Thank you, everyone. Thank you for joining.
welcome.
Yeah.
Just to mention that we are not just live here, we are also live on um, I'll start to also invite other persons to join, share the house with them, tell them join in that we can start to prepare our hearts to be having the class, and he is one of the and surgical experts that we can't wait to hear from. He is one that would speak with so much passion. I followed him on LinkedIn for a while. Surgeon doing an amazing work. And today we'll be having that opportunity to hear from him firsthand. And I'm really, really sure, I'm very sure that your coming would be worthwhile. I would also be joined by Dr. Gloria, who will join us very soon to chair this particular section. So we are quite early to have come, and I think I really do admire that. So we have about 6 minutes to wait for other persons to join in on the call. And then by exactly 6 p.m. my time, Nigerian time or West African time, we would start. I also understand that we have a lot of people who are joining in from all over the globe. Um, just to mention as well that we are joining from all over the globe because our organization is a global organization, the Operating Room Global, and it houses um, all professionals, all medical professionals cut across all medical professionals, like I said, nurses, doctors, and you can name it. We are a platform that houses them, and there they come express. It's easy for them to express, and we are currently on all social media handles. Facebook, where we just hit over 100,000 followers. We're on LinkedIn as well, so you can join us if you have not followed us before on any of our social media handles. We just celebrated our 10th anniversary, which was commemorated with our second international conference in Rwanda. It was an amazing conference, which was both live and virtual. We had a lot of attendance internationally and locally as well. So it was a great time we had together to share our experience for the past 10 years and to celebrate as well for the impact we've made so far in the world of global surgery. Um, we are also today we are coming on the platform of the Operating Room Global Ethiopia, and we are having a great time with Dr. Nicholas today. So if you're just joining in, we have about 4 minutes to start. And my name is Michael Irayame, and I am the Associate Director for the Global Education and Training. And it's under that platform that we are having this training section and this education section today. So I would employ us to stay put that in the next 4 minutes, we'll be starting officially. So I'll just be doing a welcome to everyone who I find on the chat, but on the attendance section. And if you're there, you could just do a thumbs up. And if your video is on, you could say hola as well. So currently we have over 13 persons on call. Like I mentioned earlier, we have Zeleke on call. We have Emmanuel Musa on call. We have Kaniz Fatima. Hello, Zeleke. If you're there, just say hello. Ashnakesh Zeleke, are you there? Okay, Emmanuel Musa, are you there? You could just unmute your mic if you can. I'm sure we had our mics muted by the admin. So don't worry. Okay, all right. We have Asad Ullah on call as well. Hi, Asad, welcome. We also have Kaniz Fatima, Kati Suarez. We have Linda Ado on call. We have Lucas.
Hi.
Hi, welcome. Welcome. We have 2 minutes to start this call. We have Youssef Binaf Yassab. Sorry if I murder your name, I'm really sorry. We have Rema Talha on call as well. We have Mutefang also on call. We have a lot of persons already joining in, so you could share on your socials that we've started the call already. Great and amazing people are already joined the call, and I really, really am glad to be here with you all this evening to share this amazing time with us all. Let me see if anyone has. Oh, yeah, Yusuf, hi. You look amazing. Sorry, I'm not sure. I think that some names are written in Arabic, I'm sure. So I will not be able to pronounce that. I really do not know how to read Arabic. But yeah, we are really happy to have you all join the call this evening. So thank you for joining in. We have just less than a minute to start officially. Less than a minute. I am already joined by Gloria. Dr. Gloria is already with me here this evening. So Dr. Gloria, you could say hello, welcome, and welcome on the call. Yeah, Dr. Gloria, you can unmute yourself. Can you hear me? Yes, Dr. Gloria? Okay, I'm sure she has some technical issues, which I'm sure she would set up almost immediately. So yeah, welcome everyone. We are just 6 p.m. on the clock, and I'd like to officially welcome us to this webinar. Welcome to each and every one of us. And I am really elated and happy to co-host today's virtual meeting, the webinar today with Dr. Gloria. And like I said earlier, today's call promises to be an exciting one, an amazingly exciting one at that. And I really want us to prepare as we have today's call. Dr. Gloria, are you here now? I really do not want us to take too much time, so we'll just quickly.
Yes, I can hear you.
All right, so I wanted you to say hello to everyone. I have already introduced you though, but I wanted you to also do an introduction of yourself as well. So you have the time to do that now. Dr. Gloria, you are there? Okay. All right, it's fine. I'm sure you have some technical issues which I can relate with and I can understand. So Dr. Gloria will be co-hosting today's meeting with me, and I really again want to say welcome and welcome to everyone. So I really don't want us to take too much time. We would like to quickly take our welcome address by our president, who will just do a quick 1 to 2 minutes with us to say hello and to welcome us officially on this call, and then we'll quickly go on to welcome our speaker without wasting any time. So please, ladies and gentlemen, help me welcome my president, our founder, Dr. Adebusola. Please virtual class will do as I welcome my
Yeah.
president.
Hello, everyone. I'm delighted to be here in your midst. It's a privilege actually to be having a session like this whereby everyone is connected from all over the world, regardless of your time zones. I really want to say thank you for taking the time out of no time to connect with us. Thank you for being a part of the community. Thank you for being members of TORG. Thank you for all you have done. Since the last decade, you've seen all the news and all the milestones on media. Thank you so, so much, because we can't actually get to this level without you guys. Thank you so much, everyone. And today's session promises to actually be inspiring. Excuse me. Thank you for connecting. Thank you for joining. And I want you to participate as active as you can, and we are going to learn together. Thank you, everyone.
Sorry, thank you, my president.
Yeah.
Grab some water there, so sorry. Okay, so yeah, welcome everyone again. We have over 23 persons join this call already, and I am so excited to have us join the call. I had mentioned earlier that this webinar is organized under the platform of the Global Education and Training team of the TORG. And like I mentioned, TORG stands for the Operating Room Global, and it is a community of all medical professions all over the world. And we are cut across various countries of the world. And we are part and affiliate members of different international organizations pushing and advocating not just global surgery, but global health in general. And I also mentioned that just a couple of days, let me use a couple of days back, we celebrated our 10th anniversary. So we are not just new on this space, we have made impact that has lasted for over 10 years, and we are just starting. We're doing incredible work, and we're cut across almost all continents of the world. We're in Africa, we're in Asia, we're in America, we're in Europe. We are named just how many continents we already have, and so we are cut across all the continents of the world, doing great and impactful work in the world. So yeah, we are the Operating Room Global, and if you do not know everything about us and you want to know everything about us, our admin will drop our website, which is operatingroomissues.org. Operatingroomissues.org. There you find all our impact work and everything we've done over the past decade. And as well, you can follow us on all social media handles. We are on Facebook, like I mentioned, currently hit over 100,000 followers. Over 100,000 followers. Some of the only organizations or some of the only platforms I know do that number are numbers that are platforms that are into comedy, into entertainment. But here we are making impact, and we have hit over 100,000 followers cut across people from all over the world. And on LinkedIn, we are also very active. On Instagram, we are active as well. You want to join, you want to follow us to get more of what we do. So we are the largest network of all operating room professionals in the world. So welcome, you're in the right place. And if you're not a member of the TORG as well, you can as well hit our website where you can find everything that we do. So without wasting time, I would love to call, is Dr. Gloria there now to say hello to us one more time, if she's there. If not, we'll just quickly want to head on to inviting our speaker. Dr. Gloria, yeah, welcome. Yeah. Go ahead.
Yes, thank you. Now, I had the technical issue network. Good morning, good afternoon, good evening, according to our time zone. Welcome to today's webinar. I'm Dr. Gloria Dushimirimana. I'm a secretary of the Operating Room Ethiopian chapter. So, ladies and gentlemen, allow me to introduce our today speaker. As he's Dr. Nicholas Okiengi Okumu. He is a consultant orthopedic surgeon, author, and global surgery advocate.
Sorry. We have a technical issue there. I think Dr. Gloria just had some hiccups with her bandwidth. All right, so let me quickly carry on from where Dr. Gloria stopped. Dr. Nicholas Okieng Okumu is a consultant orthopedic surgeon, author, and global surgery advocate dedicated to improving equitable access to surgical care worldwide. He currently serves as head of orthopedic oncology unit at Kenyatta National Hospital, where he leads pioneering efforts in limb salvage and musculoskeletal cancer treatment in all of Kenya. Dr. Okumu is also managing partner at Jasmine Healthcare, a network of clinics in Nairobi providing integrated dental, orthopedic, and pharmacy services. Internationally, he is a senior global surgery advocacy fellow with Operation Smile, University of Global Health Equity, and CAFU Institute, where he actively champions policy development for equitable surgical access in low-resource settings. Dr. Okomo, beyond the operating room, is a healthcare innovator working on artificial intelligence and precision medicine applications in prosthetics, diagnostics, and care delivery for underserved populations. He is also the author of Shadows Behind the Screen, a gaining novel in digital safety and selective excellence, his motivational book on intentional living and purpose. His lecture today, Standing Up for the World, the Global Orthopedic Crisis, and Our Mission to Restore Mobility, reflects his mission to combine clinical excellence, innovation, and advocacy to restore mobility and transform lives worldwide. Ladies and gentlemen, it is just my honor to one more time welcome and introduce Dr. Nicholas to us. Please welcome Dr. Nicholas with the clapping back, if you don't mind. Dr. Nicholas, you have the floor, and thank you so much.
Okay, thank you so much for the invitation to speak to the members of TOG. It's indeed a pleasure to be able to do that, and I hope that my talk today will help shed some light on the orthopedic crisis, which is part of a larger surgical crisis, and hopefully together we can kind of chart a way forward for what types of actions we can do to help. So really, I've titled my presentation "The Surgery That Changes Everything," and our focus is ending the global orthopedic crisis. And I know you've had these kind of things before, that there are about 5 billion people in the world who lack access to safe surgery. But of those 5 billion, 1.7 billion comprises people who need musculoskeletal care. So it's quite a large percentage. And then if you look at the surgical aspect, close to 70% of the surgical need is actually in trauma and orthopedic care. So we take up a large chunk of that global surgical crisis. And so if we can be able to solve it in some way, we will go a long way to helping relieve that crisis. I have been introduced. I will just leave this for a moment, but I wear a lot of hats, but they're all around healthcare and particularly surgery. If I was to kind of outline the presentation, I would say in terms of scope, we want to talk about the scope of the crisis, address the inequities in access, and then look at what kind of solutions we can use to solve the problem, and then hopefully be able to address and in a practical way kind of find ways to help. And I'm going to give you a challenge at the end, which I'm calling your 90-day mission, to see if we can have some impact on the crisis. So before we start, I'll just ask you to type in the chat, in your country where you live, how many orthopedic specialists do you think are there in total? And if you are to look at possibly a given group of about 1,000 people, how many orthopedic specialists do you think serve 1,000 people in the country where you live? So I'll just look at the chat and see what you're typing. Feel free to just share. Michael has said in total you could have about 250 orthopedic surgeons. That's in the whole of Nigeria. Wow, okay. Any other comments on this? I'm seeing people from all over the world, so Pakistan, um, Kenya as well. Yes, someone says 50 in Cameroon. What's the population of Cameroon? It doesn't have to be exact, just a rough figure is okay. So 24 million people in Cameroon are served by 50 surgeons. Wow. Anyone else? Feel free to share whatever you think is the number in your country. In Kazakhstan, they say about 1,500 for a population of 20 million. 50 in Ethiopia. Ethiopia has over 100 million people. Am I right? Yosef?
Yeah,
Wow. So 50,
140.
so 50 orthopedic surgeons for 100 million people. That's amazing. In fact, Joseph says 120 million. Anyone else? Just feel free. It's not a competition. I just want you to kind of understand the scope of what we are discussing and the level of inequity that we face. Yes, somebody says in Ireland only 130 orthopedic surgeons. I'm wondering what's the population of Ireland. Okay, so I will leave it there, but I hope already you're seeing a picture, the picture that we're trying to paint and to understand. So if I speak about you as TOG members, when I did a bit of research, I found that there are about 213,000 professionals who are registered or members of TOG, and you represent about 42 different disciplines, and from a spectrum of about 103 countries. And of these, 29 are in Africa. So if I was to give you a statistic based on what the question I was asking, Kenya, my country, has only 0.2 orthopedic specialists per 1,000 people. And this is comparable to around 2.3 in high income countries. So that gap is about 11 times. Yeah? But even in those developing countries, you find that, for example, in the United States, there's still a very big disparity when you compare urban areas to more rural locations. And so this inequity we're discussing is actually even in more developed countries. So I want to paint another picture for you. If we were to look at two patients, Maria and Sarah. Maria lives in rural Kenya. She sustained a compound femur fracture, and her nearest orthopedic surgeon was 247 kilometers away. The cost of her surgery does not look that expensive, but it costs about $850. But this is 3 times her annual household income. So the outcome for Maria, because she couldn't really afford the surgery, was a permanent disability. For Sarah, she had the same injury, but she was able to have emergency surgery within 2 hours. The cost of her surgery, however, for the same fracture was 12,000 US dollars, which was covered by insurance, and she went ahead to have a full recovery. So you can see that the difference is quite stark when you compare Kenya and again somewhere like in the US, in a urban city like Denver. Again, I'll ask you to just type in the chat how many people globally you think lack access to surgical care. And yeah, you can type in your answer very quickly and we'll just take a look at what you guys think. Anybody can give an answer? Okay, Joseph says 2 billion. Anyone else? I'll give a hint. It's more than what Joseph said. Okay, nobody is brave enough to off. Yes, Joseph goes in and says close to 5 billion. That's actually quite accurate, Joseph. It's 5 billion people in the world who lack access to what we call safe, affordable surgical care. And because of that, we get 17 million preventable deaths every year from what we call surgical conditions. So things that could have been treated with surgery. But if you look at it a bit also economically, it adds up to 12.3
Excuse
trillion
me, Nicola,
dollars.
doctor.
Yes.
Hello?
Yes.
The
Yes, I
slides
can hear
are
you.
not moving.
All right. I will
The
try
slides are
to.
not moving.
I'll try to solve that. Just 1 minute. Okay. Let's try again. Entire screen. Okay, can you see my screen now?
Yes, we can.
And are the slides moving?
Yes, they are working now.
Okay, good. So now, when we look at the economic impact, it's about $12.3 trillion lost economically. And this is an estimate that by 2030, we'll be losing that amount of money because of the lack of access to surgery. And this is a statistic from the World Bank. But if we look at orthopedics specifically, we find that musculoskeletal conditions affect 1.71 billion people worldwide, and they account for about 17% of global disability. And in terms of cost, they cost society over about US dollars 2.1 trillion each year. And this burden is growing. So this graph here is just showing you that the proportion of musculoskeletal disease is significant when you compare it to the overall surgical burden. And trauma surgery is needed for 90% of road traffic injuries. And if you look at even a simple condition such as clubfoot, which can be treated actually with just $150, you find that over 200,000 children suffer every year and end up with lifetime disability for something that could be treated, with $150. If we look at the inequities in access, we've talked about surgeon density. And in a country like Ghana, there are 0.9 orthopedic surgeons per million people, compared to the US where there are 75.2. And then in terms of trauma, 1.1 million road deaths annually. We have 20 to 15 million injured each year, and 92% of these deaths are in low and middle income countries. And if we could prevent road crashes, we would add approximately 3% to our GDP. So our economies lose 3% of their GDP every year because of road crashes. So the conclusion of this is access is profoundly unequal, and LMICs have a fraction of the workforce and resources available compared to what we find in high-income countries. I talked about clubfoot, and we were saying approximately 174,000 children are born with clubfoot each year, and 90% of those cases occur in low and middle income countries. And early treatment with a method that is very simple, Ponseti, costs under $200, but many children never receive it, leading to lifelong disability. So I'm just using these examples to kind of, paint the picture of what the crisis really is, so that hopefully as we move to solutions, we can understand the magnitude. So we need to build systems. We need to build systems that are multidisciplinary, that will help us address this problem. I want us again to just type in the chat, what are the kind of solutions you think that would solve this problem? Sorry, today I'm not just presenting, I want us to talk. Please go ahead and just type in what kind of solutions you think we need to solve this crisis. Someone says indigenous training of professionals. Policies, yes, to increase road safety. For example, training more surgeons in trauma. No solution is silly. Just please share. Early detection of bone tumors, more training. Yes? Diversity and inclusion of multidisciplinary approaches. I'll take those two as separate things. Diversity and inclusion, yes, and multidisciplinary approaches. And then, sorry, Bright, I will ask you what ANC means. Quick assessment and reaction when the case has been noticed, organizing skill training workshops to help the situation, and education towards public health hazards that may lead to trauma, I would assume, workshop and mentorship. Yes, so what I'm getting from the chat is that the ideas to solve this problem already are with us, and we just need to work on them. So I want to give you some two examples of things we're doing at in my specific unit, orthopedic oncology. So we've first developed a dedicated subspecialty clinic in Nairobi, and this was something that we saw working in other parts of the world. So we didn't need to develop a new solution. We just needed to implement it. But the key thing that I want to stress is that we work as a team. If I, the surgeon, developed this unit and I did not have all the other professionals, then this program would not work. So without nurses, without anesthesia providers, without surgical technologists, without people in my TSSU, the biomedical engineers, limb salvage surgery would not be possible. And that's why I'm stressing that we need to build multidisciplinary systems. So it has to have the surgeons, it has to have anesthesia, it has to have nursing, it has to have tech, it has to have everybody, including rehab and admin. And all those people are members of TOG. So your role as an organization in spreading this message becomes even more important. We have also done innovations like using technology like 3D printing, AI. But I wanted to talk about one organization called Sign, which developed a free nail that is distributed now in 115 countries. And the real beauty of this system is that it does not need complex equipment like image intensifiers. You can put this nail in almost any area in the world. And as of now, they have done 150,000 surgeries, and the implant costs only $200. And from the data they have a 95% satisfaction rate. If I was to go back to what we talked about, clubfoot, we've talked about the treatment, that it costs only $150. And the success rate is also 95%. And the return on investment, if you talk about it in US dollars, over a lifetime is $200,000. Why can't TOG and other organizations really advocate for this simple intervention? It would be life-changing. And up to this point in time, over 200,000 children have been treated with this method globally. But the number could be higher. We talked about the fact that only 10% of children with this condition are actually treated, which means that 1.8 million others could have been treated. If we talk about simple things that we use in theater, like surgical safety checklists, these are really, really key tools to make sure that the surgeries we do are done well, are relevant, that we reduce things like infections and improve outcomes, and they can be adopted by every member of the TOG team. So we are really, really talking about simple interventions that if we could push together as healthcare professionals, we could make a big difference. If we talk about something that is common in Africa, and I will ask if it's common in the rest of the world, in my theater, we tend to waste a lot of time. You can arrive at 8:30 and end up starting your surgery at 10. And I would say 95% of the time, it's not for lack of the surgeon being available already. So this brings us back to the element of teamwork, that if we worked together, we might be able to even do more surgeries in the current setting that we have without changing any technology, without, adding any money. We could simply do more by being more efficient and working together as teams. So I want to give the members here a bit of a mission. Take one orthopedic procedure. If you're a nurse, audit the process right from the ward to the theater to the recovery room and see, can we fix our workflow or an instrument issue or train our peers so that we can make this surgery more efficient and hopefully be able to do more with the resources we have now. Sometimes we hear, I work in a teaching hospital, the anesthesia can take longer than the surgery. I'm not criticizing because we are teaching students, but maybe we could find a way, for example, mastering regional blocks for orthopedic surgeries, teach our colleagues in maybe a more effective way so that we can be able to move forward with our surgeries in a more efficient way. When we talk about sterilization, the biomeds, are we able to create a repair and maintenance plan and stick to it? Can we champion one appropriate device that is, tech related, whether it's the drill or the sign set? And the story can go on and on and on. If we talk about rehab and admin, are we implementing early mobilization protocols? Are we actually looking at the return on investment for one orthopedic program and helping leadership to understand what impact we can have? So if you just took a few of the ideas I'm sharing here, pair up with one or two colleagues, and see in the next 90 days if we can actually make a difference where we work. That would be actually our greatest impact on this crisis we're talking about. So I want to bring you back to the picture I started with. 1.71 billion people, but TOG has 213 perioperative professionals across 42 disciplines in more than 100 countries. If all of us made just a small change, imagine the impact we could have on the world. We have the knowledge, the technology. We now understand that it's an economic crisis. What we need is commitment to build systems, adopt innovations, and lead locally where we work. So I'm asking you a question. Which world do you choose to create? A world where everyone has access to mobility, or one where avoidable disability persists? Make your commitment now. Let's stay connected. Let's keep talking. I will share my LinkedIn on the chat. And thank you for listening to me.
Thank you so much, Dr. Nicholas. Thank you so much. That was the we had. Thank you, Dr. Nicholas, for also inspiring us and charging us to become the change that we desire. Our countries will be better, especially for those of us who are coming from the LMICs, if we just contribute our parts. No matter how small, no matter how little, our countries, our regions will be better for it if we contribute our part. So again, thank you so much, Dr. Nicholas. And like he said, we could stay connected with him. I have already connected with him on LinkedIn. You can
Hello? I think we lost Michael for a minute. Hopefully, he'll be able to reconnect. I'll just open up the space for any questions, any discussion point that we would like to share, and we can talk together and see what we can build.
I totally apologize, everyone. I'm so sorry for that break in transmission. And like I said, Dr. Nicholas had already charged us that we can connect with him on LinkedIn, and he will be willing to connect. So if you have any question, you can please drop in the chat box while we take your questions now. If you have any questions at all, you can drop them in the chat box. Okay, but Dr. Nicholas, I would like to ask you my own question, and it would be on advocacy. You talked about clear foods, and I would really want to ask questions around what do you think one who is trying to start, a very young medical professional who is looking at starting his advocacy journey, what would you suggest, especially in areas where these things are lacking? What would be your counsel?
So if we talk about advocacy, any one of us can be an advocate. Advocacy is just speaking up and sharing your opinion on an issue or matter that affects you or affects people where you live. And the purpose of that is to change, change minds, convince people to approach it in a certain way. So if I was to speak about the topic we've talked about, which is clubfoot, clubfoot does not actually need an orthopedic surgeon. A lot of the work that is done around clubfoot is by orthopedic plaster technicians, orthopedic occupational therapists, and people like that. And so we can work on making the treatment more widespread, in terms of training. We can improve the awareness, and all of us can participate in that so that we can then make a change in that specific area. But when it comes to advocacy, it's just speaking up, and you can speak up in so many different ways. You can talk to people directly, the ones you see every day. You can, for example, do what we do in terms of writing opinion pieces. Some of us have even ventured into things like podcasting and so forth. So even talking to your politicians. So please feel free to be advocates for things that you're passionate about. And as you can see, I'm very passionate about the surgical crisis and orthopedics, and I speak about it all the time.
Thank you very much, Doctor. Me also, I have a question about orthopedics. As we have seen, many people said we need trainings to get many orthopedic surgeons. So what can we do as some places where there are no enough trainers, there are no sites for trainings? What can we do? And the crisis is also there.
In the last 1 year, I've been working with orthopedic surgeons from all over the world, right from Harvard in the US to my neighboring countries like Tanzania and Uganda. I've been to Rwanda. And in terms of my specialty, orthopedic oncology, we are the only unit actually in the whole of East Africa. So if there's a particular need for training in your country and it's not there, you can find partners in other parts of Africa. My university, the University of Nairobi, trains surgeons from 5 or 6 different countries, all the way from Cameroon down to Botswana. So you are welcome to come and train. But more importantly, once we have one or two of those people in your country, invite us to come and work with you and build those systems so that it grows and you can eventually have your own training programs, because it's not sustainable to send people to other countries. But as a beginning point, your neighbors are available to help. I'm seeing some questions in the chat. Let me try and go upwards. So, asks about integration of AI and robotics in surgery, especially in low and middle income countries. We're actually using a lot of AI where I work. For example, we have 3 projects running currently. One is on production of prosthetics. So we have one project we are working on with the of Rwanda, with Carnegie Mellon University, with another university in Kenya called Dedan Kimathi. And we are using a video recorded by a patient, putting it through what we call an AI machine learning algorithm, and using 3D printing to produce the prosthetic. The benefit of that is that you can produce the prosthetic faster, literally in 1 day, and it's much cheaper than the normal process. So that is one project where we're using AI. We're also using AI to develop what we call screening tools. So for detecting bone tumors, and we are building a model where we train, we use put an AI program in ultrasound machines so that it can help primary healthcare workers pick up tumors early. We're actually looking for collaborations on that because we want to build a data set. So AI, 100%. You can use AI to produce surgical implants. You can use AI to guide you even in the surgery. So there's a lot of applications of AI in orthopedic surgery, and they are very beneficial in low and middle income countries. Another question is by Pierre Tuisson, and he says, I would like to ask, as a nurse, what do you think about nurses contributing in OR during the procedure, and what can be done to increase their skills about orthopedic cases? My answer to you is nurses are very, very, very important in the orthopedic surgeries. In fact, in our hospital, we are even training what we call specialist nurses. So they will only do orthopedic work. And the benefit of that is because they understand what we are doing, it makes our surgeries more efficient. They know the types of implants we use. So the nurse is very, very key to successful orthopedic surgery. Then I see a question from, oh, this was the one you asked, Gloria. Thank you.
Thanks so much, Dr. Nicholas, for the insightful presentation. It's really good to see the role of artificial intelligence. I know low and middle income countries in terms of orthopedic surgery still have a long way to go. And it's actually really good that we brought you on board to talk about more of the need for training and retraining and sustainability as well. I would like to ask, what projects can we actually collaborate on? I know you've actually done your research. You've seen how extensive the network of TORG is, and definitely we should be doing more of awareness, helping in surgical care as much as possible. We're in the G4 Alliance, which Dr. Michael knows about as well, helping in SOTA care, like surgical obstetrics, anesthesia, and more. I think for orthopedic surgery, we need to do more in that regard as well. We currently have a multinational research ongoing in terms of orthopedic surgery, which is related to amputations. Amputations, we have an upcoming one, which is related to bellwether surgery, geospatial aspects and more. And especially, I think we need to expand that scope. Like you said, you mentioned a project and you mentioned one of the key innovations for intramedullary nailing, which is SIGN. I think we would like to know more about that and see how we can actually work with that company, if possible, organize like an in-person workshop led by an expert faculty like yourself in Kenya. I think it would really, really be good, because if we can have an IM nailing that is affordable as 200 USD, as you mentioned, I think it's really, really great, because I know what the cost of other similar innovations could actually be. And if it's not affordable, how can we promote this healthcare that we are all trying to work towards? So I think we need to know more about that sign. If you don't mind, maybe if you can share more information after this session and see how we can collaborate, and also see how we can have an in-person workshop or even a global online one that we can know more. And it would even be better if it's hands-on, you know what I mean? Like workshops and training and more. And at the same time, I would also like to suggest that, based on your position and based on your experience, you've been working with other countries and other orthopedic surgeons. If you see any upcoming opportunities, even for TOG members, aspiring professionals, even if it's a scholarship, that they can benefit of these things, these opportunities as well. If you can share that with us, I think we would be delighted to know more about them, promote them across the community, and see how we can have representation in that regard as well. If okay with you, as you said, we need a commitment to actually build systems. We need to adopt innovation. We need leadership at local levels as well. And you've said a lot, which I've personally taken some notes. So I think we need to move it forward from this and let it not just stop at this level. It's a global crisis, and we are a global organization. So we should do more in that regard. We also have the India chapter currently, led by Dr. Krunal, having a major initiative on towards zero infection in orthopedic surgery, training and retraining staff, demonstrating how to do gloving, gowning correctly, because in orthopedics, implants take most of the surgeries would have one implant in one way or the other, depending on the part of this the body parts that is being operated on. And there has to be zero infection rate. That is the goal of that initiative anyway. And there's been so many trainings in the background in that regard. So that needs to be extended to other countries as well. In Kenya, we would love to have like a partnership with your hospital, Kenyatta National Hospital. We've seen what you demonstrated, what you explained, in terms of multidisciplinary approach. As you said, TORG has 42 disciplines. So if we could have a collaboration with Kenyatta National Hospital and also help to give visibility to what your department is doing, that would really, really be great. And there could be representation of TORG members in the facility as well for your upcoming programs, workshops, and more. So I think we need to push this agenda forward, if it's okay with you, Dr. Nicola. So thank you so much once again for honoring the invitation, and thanks to the entire team for facilitating this session. Thank you.
Thank you also again for the invitation, and I hope the discussion was useful. I didn't want to, bombard you with just statistics. I thought it would be important to have something that is practical and we can do even today.
Thank you. Thank you so much, Dr. Nicholas. And thank you again to our president and founder for buttressing that and seeking such very important collaboration. And I hope that in the coming days or coming months, we'll be able to see what that alliance would have struck. Thank you so much again, Dr. Nicholas. We do not have further questions. I would just like to make a few announcements. Like I have done earlier, I mentioned that we should ensure that we fill the certification form. That would make you get the access to the certificate for this particular training and education section. So do well to head on to fill that form. very quickly. And like our president has said, we are an organization that cuts across over 42 healthcare professionals. So we are welcoming everyone in the healthcare system to join our platform. We do not discriminate any profession at all. Everyone is welcome to join us. So we are a platform that houses all professionals. If you can imagine 42 different professions in under one platform, imagine how much connection, how much collaboration you would be able to strike. And yes, like I said, we are in all the countries of the world, and we are welcoming membership from every corner of the world. So to head on to our website to sign up as a member of our organization. I guess we can still hear me. Sorry, can we still hear me?
Yes.
Okay, all right. So we're rounding off this section right now, and I hope that we'll be able to connect on socials, connect on every social media handle that the TOROG is on. And I hope that the next training section would also welcome you as well to join us. Thank you so much, and from I and Gloria and all the entire team of the TOROG, especially the training and education team, I'd like to say thank you for joining us and see you on the next one. Dr. Nicholas, I'll say hello on LinkedIn and we'll continue to connect from there. And please do not forget what my president had mentioned earlier. Thank you so much.
No problem.
Thank you. All right, bye-bye, everyone, and have a good day.